Okay, hello all my wonderful students out here. Today we're going to have another session on case-based study. This time the case-based learning which I am taking is from cardiovascular system. So I welcome you all on my YouTube channel as well as my Telegram, that is Physiology Synapse to Success, where you can enroll and you can come up with all suggestions you need the topics for. Now let's begin with a case history because it is a case-based learning and it tells you about a 27-year-old male Ramchandra who is an assistant manager at a departmental store. One morning he awakens from a deep sleep and realized that he was more than half an hour late for work. That means he's getting panic because he woke up a bit late. So he is panic and he momentarily, he thinks, oh God, why did I get up late? Why did I socialize? And he just jumped out of bed. So all these are just given to you to make the case more interesting. This may be sometimes also the confounding factors. Now briefly, he felt very light-headed, as if he would just faint. He had a sensation as if the heart rate was racing. That means the heart rate has been increased and he had a light-headed feeling. He thought that he will faint. So remember what the question tells you. The moment he woke up, what did he thought? As if he won't be able to stand, and heart started beating. As he walked towards the bathroom, he noticed that the lightheadedness dissipated. That means it was no more, and the rest of the day was uneventful. Very beautifully explained, and just at a glance, if you could realize what the question wants to tell you. He woke up, he felt lightheaded, but after some he was absolutely normal. Now, what is the case history behind and what the question wants to tell you? When Ramchandra moved rapidly from the supine position, he was lying down on bed, he was sleeping, and he immediately stood up. What happened? There was a brief initial decrease in the arterial pressure, and that initial brief decrease in the arterial pressure gave him lightheadedness, right? And now let us discuss what produced this transient fall in arterial pressure. So this is my discussion. Like, if I am supine and immediately I woke up, I stood up, I felt immediately or momentarily lightheadedness, but then it was absolutely normal, it was uneventful. So what is the cause, or why did the decrease in the arterial pressure let him feel lightheadedness? Ramchandra's lightheadedness was transient because a reflex was initiated, and that reflex restored the blood pressure to normal. And my question to you is, what is this reflex? What is the effect of this reflex on myocardial contractility, on the total peripheral resistance, or on the capacitance of the veins? And my question to you is, what receptors are involved in this? So can you think, what am I trying to ask? Because this question is not only important for your theory in the clinical based application, it is very, very important in your viva, where we ask you the postural effect of blood pressure, right? We ask you the postural effects on blood pressure. Yes, this is nothing but this is orthostatic hypotension. What is the diagnosis? Orthostatic hypotension, which is a phenomenon where the arterial pressure decreases as one person stands up. So when a supine suddenly moves, when a person who is lying down in a supine position and immediately stands up to a standing position, what happens when you are supine and immediately you stand up? There is something which is called as pooling of the blood in the veins of the lower limb. That is, in the legs there will be pooling of the blood. Because of this, that means because the veins have hold the blood, that means the capacitance of the veins was increased, their accommodation or their compliance was increased because they were holding large amount of blood. The blood flow or the venous return to the heart decreases. So what happened? Venous pooling of the blood in the veins of the lower limbs. Okay, the veins of the lower limbs got accommodated with large amount of blood. which decrease the venous return, और जैसे ही venous return कम हो जाता है there is a decrease in the cardiac output. Remember, this is absolutely going with the Frank-Starling's law, that is the relationship between the venous return and cardiac output. And this law tells us, what does this law tell us? This law tells us that there is a relationship between venous return and cardiac output. An increase in the venous return up to a physiological level will cause increase in the endastolic volume. Definitely, if there is a decrease in the venous return, there is going to be a decrease in the cardiac output, right? So this is a very, very important application, a very, very important application of your Frank-Starling's law, the relationship between cardiac output and venous return. Venous return can also be mentioned as endastolic volume, right? Now, we've seen that Ramchandra, when he stood up, he felt light-headed. What is the reason of this lightheadedness? There was a sudden decrease in the arterial blood pressure. So because of the venous pooling of the blood, what happened? Momentarily the venous return and the cardiac output reduced, and therefore the blood pressure was also fallen down. So because of this, there was a very, very brief period of cerebral ischemia. Very brief. But remember, the cerebral circulation, it shows auto-regulation. That means even if the range is as low, the mean blood pressure as low as 60 mmHg, or the mean blood pressure as high as 140 mmHg, the cerebral blood flow is going to remain constant. Therefore, only for a brief period, he is going to have lightheadedness. लेकिन उसके बाद the total day or the entire scene will be uneventful. Now, what receptors are involved over here? So you know that the very, very important receptors involved over here are your baroreceptors. ठीक है, they are your baroreceptors. So first, just enlightening you about baroreceptors. Before that, let's understand this entire event in the form of a flow chart. And this flow chart is also going to be very, very helpful to you in writing your answers. आंसर लिखने में भी जब आप बैरोरिफ्लेक्स लिखेंगे तो आप ऐसा ही चार्ट बना सकते हैं. So on standing, when there is venous pooling of the blood, that means the veins in the lower limb, they are accommodating more amount of blood. This is going to decrease the venous return to the heart, and therefore there is a decrease in the cardiac output, and therefore there is a decrease in the mean arterial blood pressure. Now, the blood pressure is sensed by very, very important receptors which are called as mechanoreceptors and other baroreceptors. We have got carotid, sinus and the aortic arch. So, as there is a decrease in the blood pressure, there is decrease in the stretching of these receptors, their firing rate will decrease. Because their firing rate decreases, it gives this interpretation to the nucleus of tractus solitarius. Nucleus of tractus solitarius. Okay? The nucleus of tractus solitarius gets this information that the firing of the baroreceptors has decreased. What will they do now? The blood pressure has fallen. What will they do? They will decrease the parasympathetic flow to the heart, but they will increase the sympathetic flow to the heart. And whenever there is increase in the sympathetic flow, it is not only to the heart, but also to the blood vessels, that is the circulation. There will be increase in the heart rate, contractility causing increase in cardiac output, effect on the arterioles causing vasoconstriction, increase in the total peripheral resistance which increases the diastolic blood pressure. Cardiac output increases the systolic blood pressure, and the constriction of the veins, that means venoconstriction, which is going to cause increase in the venous return to the heart. And all these factors are going to restore your blood pressure towards normal. So boys and girls, this particular chart is very, very important, very easy flow chart to explain the entire baroreceptors. Now remember, normally you are confused between aortic bodies carotid bodies. ठीक है, you are confused between aortic bodies and carotid bodies. So remember, these bodies are chemoreceptors. They are chemoreceptors, but you have got carotid sinus and aortic sinus, which are baroreceptors. So the chemoreceptors primarily has got a role in regulation of breathing, that is respiration, where they are going to judge the levels of, most importantly, oxygen, carbon dioxide, H plus ions, potassium, lactic acid, cyanide, nicotine. But the carotid sinus and the aortic arch, they are going to judge more of your blood pressure. So they're more important in blood pressure regulation. Okay? These are mechanoreceptors, whereas these are chemoreceptors, right? Carotid sinus and the aortic bodies, both of them are supplied by the ninth nerve, glossopharyngeal nerve, whereas the aortic sinus and the aortic bodies, they are supplied by the 10th nerve. Okay? And baroreceptors, they are going to judge what? They are going to sense the mean blood pressure. They do not sense systolic or diastolic blood pressure, but they sense the mean blood pressure. Okay? And play a very, very important role in the day-to-day regulation of blood pressure. At a moment to moment, you are sitting, standing, they prevent the fall of blood pressure. Orthostatic hypotension is a very important phenomenon, especially in the old age persons, where the sympathetic activity declines. Okay? And these have got one important disadvantage, that they are, adapting. They get adapted within 1 to 2 days, and therefore they are very, very important, and rather only important in the short term regulation of blood pressure, which is the nervous regulation, which acts within seconds to minutes. Right? I hope this was crystal clear to you. It is a very important long question and a very, very important question in the Viva. So with this, I wind up, boys and girls. Thank you. So please join more and more. Also give it to your friends, and let the channel be helpful to everyone in integrating physiology towards clinics. Thank you, and God bless you all. And always make it a happy learning.